Well, good evening and welcome to Jen Cares, powered by Chosen Counselors. I'm your host, Jen Cares, and the founder of Chosen Counselors, a nonprofit organization that seeks to inspire, motivate, empower, and strengthen individuals and families. As always, I thank each and every one of you for tuning in, for liking, for sharing, for commenting. I just truly, truly appreciate each and every one of you. Last week, we talked about where the money resides with the founder of Philly Teen Jobs. Friends, be sure to follow her. She is a much needed resource, okay? And interestingly, after the very next day, she was sent a post that talked about they were looking for mentors. So if you are interested, they're actually paying to have those mentors. And if you're interested, be sure to follow her and to connect with that amazing resource. Oh, we learned so much about that program. Well, about programs for young people. They have programs to help teens and get their first apartment and help them save up for their what's it called, the deposit. I wish I knew about those things when I was growing up. But they have other programs that give you college credits, not just getting experience, but also you can get paid for some of the experiences that she's sharing about. So be sure to follow Philly Teen Jobs on Facebook and on Instagram by searching Philly Teen Jobs. A ton of resources. So be sure to also catch the rewind or the full episode right here on Facebook or on our YouTube channel. Tonight, we're going to continue our youth themed series, Letters to My Younger Self. And tonight's topic is Savage Love. Jason Derulo sings the song Savage Love, where his love interest was only with him to get back with an ex. Have you been there before? I've heard countless stories of this kind of savage love. And we'll talk about it more in a moment. But what are some songs that come to your mind that make you think of savage love? I thought of Jasmine Sullivan. She said, "I'll bust the windows out your car." Bill Withers, "Ain't No Sunshine When She's Gone" came to mind. Beyonce, "Irreplaceable" came to mind. A whole bunch of songs that lets us know that a lot of different people are dealing with different things as it comes to relationships. Sometimes we're doing it great. Sometimes we're not so great. And though this is a youth thing, guess what? No matter how old we all can learn something new as it relates to relationships. So a lot of different things can happen. We talked about the first week, we talked about Love is Blind, and we shared about Eve's song, where sometimes people get into some situations and don't know how to get out of them. So again, tonight we're going to talk about when we're in a situation, when things happen, how can we protect ourselves for the next time? Okay. So I met Dr. Myra some weeks ago at a fair, and we had such a good chat. And I wanted to have her on to educate us about being safe when it comes to savage love and the likes, okay? So help me welcome and introduce Dr. Myra Rutland to talk about savage love. Woo!
Hey, woo! Jen, thank you so much for inviting me on to your show. I really, really appreciate this. And, I am very passionate about what I do for a living. So, I'm happy to have any platform to share that information.
Yes. And we're just so grateful to have you again. Just in that moment when I talked to you, I was like, oh, we got to get her because she's going to help us. And that's where about having some tough conversations, having some real talks, because there's different things that we need to do to protect ourselves and to be aware of. Because sometimes we think, oh, no, that can't happen to me. And if we learn anything about in this last year, life is short. And those that thought Corona couldn't touch them, it did touch them. Those that thought unemployment couldn't touch them, it did touch them. Those that may have thought homelessness couldn't touch them, it did touch them. So we want to be able to talk about those things that we think might can't touch us, that really can possibly touch us, and how to be safe in those instances. So over here, we start with a quote of the day. And today's quote of the day is, "You were born to be real, not to be perfect." This is a good one. Again,
Love
you
it.
were born to be real, not to be perfect. What are your thoughts on that?
I really love that, Jen, because I always tell people who don't really know me very well to kind of be prepared because I shoot straight from the hip and right between the eyes. And over the years, as I've matured, I've learned to soften that hit a little bit. And you can't always hit people with a hammer, but I do believe in speaking the truth in love. Feel is extremely important. If you lack transparency in any relationship, the relationship is going to be hindered.
Very true, very true. And I like that. And sometimes we need that tough love because when you said it softly 5, 50, 11 times, we wasn't listening. And then you got to say, you know what? If you don't get your act together, so it's good to find a balance, but also knowing that sometimes that tough love is needed. They say hard head make a soft behind, right? Because
Yes.
we didn't listen. So the hope is that today we can share some things to help us not to have that soft behind, because that's not a good feeling. When I can remember the 2 times I got a little beats and things.
Oh, you only got two?
Yes. I was not a fan. I was not a fan. It may have been 3, but no more than 3 because I didn't like that. I said, "What you say? Okay." You gave me that look. Okay. But in that sense, but there's other things in life that has beat me a little bit because I didn't listen. Because that love was shared, and I was like, okay, yeah, whatever, and thinking that I could do what I could do and things of that sort. So in that instance, more than 3. But as a kid with my mama, no, I didn't play that. I didn't like it. So, Dr. Myra, tell us a little bit about yourself.
So I am a family nurse practitioner. I have been a nursing professional for over, excuse me, come August, it'll be 35 years.
Well,
Um,
congratulations.
Thank you. Thank you. I remember it because I was pregnant with my oldest at the time. She hates when I say that because I always give away her age,
Oh,
but it's my favorite way to remember because I was determined to get through nursing school. And
mm-hmm,
I also wanted to start my family at the
mm-hmm,
time. So we planned her, and I needed to have her after graduation and before the state board. So that meant she had to be a June baby. So,
mm-hmm, mm-hmm.
you know,
Very
I,
nice. Very nice. So, did you always want to be a doctor? Did you always want to go into this field?
so here's the crazy thing. I did not. My initial plan was I made a promise with my best friend at the time. I was living in New York. I grew up in New York in the Bronx.
Yeah,
That we were
Brooklyn
going to
too.
that we were going to go to Howard for
Right.
school, and we were both going to go to law school. And she actually went to Howard. And but after my parents divorced and we moved from New York to Philadelphia, I did not follow up on that promise, and I backed out of it because I was afraid that I wouldn't have 3 hots in a cot.
Mm-hmm,
But I knew I only had one to get through school. I grew up with very limited resources.
mm-hmm.
You don't know you're poor until years later when you look back. I was like, huh, I guess maybe we were poor.
Uh-huh, uh-huh.
But I didn't feel poor. I didn't feel poor in
Right.
spirit, but I didn't have the resources at my disposal that I had now. So I felt like staying local was safe.
Mm-hmm,
Staying in my parents' home for the time was safe because I knew I would have somewhere to live, somewhere to eat, and I could go to school, get my books, and my parents were able to support my younger sister to go off to college, and she went
mm-hmm,
upstate to Pittsburgh. But no, nursing was not my initial on my radar. I wanted to be Lisa Thomas Laurie. I wanted to be Beverly Williams at the time. You're probably too young to know who that is, but I wanted to
mm-hmm,
be Renee Chenault Fatah. I wanted to be that African American woman on TV doing
mm-hmm,
journalism. Um, but what turned me to nursing was my boyfriend at the time had
mm-hmm,
recommended it. And I was like, okay, well, I guess that would mean I would definitely always have a job. And that may sound kind of shallow at this point, but the reality is that was the reality. I
mm-hmm.
needed to make sure that I came out of school with something where I could earn a living at and I would be guaranteed to get a job. And me being famous and being on TV was not a guarantee in my mind. Who knows
Mm-hmm.
what God had in store for me, but I switched paths, but the Lord still blessed it, and I was able to transition into something that was a good fit for me because I like people.
Mm-hmm.
Um, I am not scared of blood. I told you I grew up in the Bronx. You know, um, I didn't mind, icky things. I played with dirt and worms and caterpillars, and so that was not a problem for me. And I finished my degree in journalism, however, at
All
Temple,
right.
and then I went to nursing school at community college, yay CCP. Um,
Yes.
went and got my bachelor's in nursing from Drexel many years after I finished my associates, and then got my doctorate in nursing practice at Temple. So I started at Temple and finished at Temple. you
Very
know.
nice.
hmm So now
Yes.
I do primary care for all ages from cradle to grave, but I also specialize in infectious disease. Um,
Yes.
yeah, so that's how you and I kind of connected
Mm-hmm.
because
Mm-hmm.
that was maybe accidental too because my first settings, my first or second settings for training were in sites where we saw lots of patients, initially women who were living with HIV, and I became interested in it. As a nurse practitioner. And so I requested to go to other sites. Now, let me just wind back a little bit. When I first started my nursing career, it was in the 80s. And
Okay.
if you know anything about the history of HIV, you know that that was when HIV really became this mysterious, scary virus that was killing people, and
Mm-hmm.
particularly gay people, gay men. And I happened to be working at which is it's now Good Shepherd, but
Mm-hmm.
it was then Graduate Hospital at 18th and South. So if you know
Okay.
anything about Philadelphia, you know around 18th Street, South Street, probably from 13th all the way down to 9th is affectionately what we call the neighborhood. So I was there when HIV hit, and I
Mm-hmm.
would have patients. We'd have patients on the unit that I worked on, and my colleagues were afraid to take them
Mm-hmm.
because they're like, oh my god, I don't know what they have, I might get it. Kind of like with COVID, people were afraid to take COVID patients now. And I was like, well, okay, it's a bloodborne disease, right? Okay, well, we take the same precautions that we do if it were any other bloodborne disease, hepatitis, or if it's droplet, you take care of droplet, so you're trained to do that as a nurse. So I was like, well,
Mm-hmm.
look, if you don't want that patient, you take my other two and I'll take that one. How about that?
Good
So
barter.
good barter, and it made my nights easier. And I was able to connect with people who basically were ostracized, and it gave me a hindsight. Now I had no idea then what I would be doing would be relevant to what I'm doing now, because those people were getting 6 and 7 pills 3 and 4 times a day, sometimes more, up to 10 pills, like 3 and 4 times a day, just to live. And sometimes
Mm-hmm.
they didn't live. And many times those pills would have interactions that were troublesome. And, it was a lot. It was a big learning curve.
Mm-hmm. Good, good, good. You said a couple good things. A lot of good things. I will say staying at home for school is cheaper. Ask me how I know. But if you can't go away, do go away. It's a great experience as
Yes,
well.
yes, I
Um,
agree.
I also love that you shared like who your role models were for why you went into journalism and things of that sort. And I aim to get professionals that look like me to show younger me's that they can do amazing things too.
Yes.
And you will see a diverse, guest line, but I also do purposely try to find those that look like me because I want us to know, look, you can shoot for the stars, sunshine, young king, young queen, and do
Yes.
amazing things. And I also love the piece of the population that you're specifically working with. And that really is what tugged on my heart to even have the episode tonight of Savage Love, because when we were talking, you were saying how you said you was working with females and women. However, it's more common, or we perceive or think that it's not more women that suffer or deal with
HIV.
HIV.
Yeah, I'm so glad that you brought that up. And here's the thing. Yes, HIV is primarily, seen in the gay population, okay?
Hmm.
Gay men, if you're African American and you're in Philly, and it might even be across the United States, I need to look at that. You have a 1 out of 2 chance of catching it. If you're a gay Latino, 1 in 4. If you're
Mm,
a gay white male, it is 1 in 11.
mm,
However, right behind that gay population of men, you have African American women who are most affected. They're at the
wow.
top of the food chain. And
Mm,
I can, just share that I probably had seen about 5 or 6 new diagnoses, actually 6 new diagnoses of HIV between fall of last year and currently. And
mm,
of that six, 5 were women and 1 male, and he
wow.
was heterosexual.
Mm. This is good because it doesn't because some people say like, that's a gay disease and things this or somebody living a homosexual lifestyle, and it really is fluid and anybody can get it.
Anybody. If you are
Mm,
sexually active, then you need to be cognizant of what comes along with being sexually active. And it
mm,
exposes you to anything, whether it is, herpes or, you know, um, chlamydia, but we'll
mm.
get more into that, I know.
Yes, yes.
Mhm.
This is good. This is good already. So tonight's theme, savage love, and the phrase. I actually thought I was trying to stay hip with the young kids and things of that sort, and because Jason has this song, it was like, "Did somebody break your heart? Looking like an angel, but you're savage love. When you kiss me, I know you don't give two things." It's cuss word there. We are clean over here, but I still want that. And the thing is that sometimes we get in situations where people don't care about us and they treat us any kind of way, or they do different things because they get upset about something that's happened to them. And it reminded me of some years ago when we had payphones, telling my age. As a kid, you would like put your hand in and see if you get some change and things of that sort. And they would tell you don't do that because something could be in there that could, give you a disease and things of that sort. They would tell you be careful when you go to the movies because people would put needles and things. And in a sense, that's a savage love where it's like, I got it, so now I want to give it to you. They have people that are rampant with that have been diagnosed, and because they're upset they were diagnosed, they're just going out there and living their best life and not telling people. Can we talk on that of how real that is and how real that is?
That is real. That is real. I don't think it's prevalent. I don't think that's the majority. I think
Mm-hmm.
that primarily that, most patients who are living with HIV or any infectious disorder
Mm-hmm.
are not intentionally spreading it. Be, in fact, many of them are struggling, and the ones who are newer to the diagnosis are living somewhat depressed and having a hard
Mm-hmm.
time wrapping their heads around it. However, there is this element of a savagery where people will and have. I've heard that from other patients, and um, unfortunately, you find that on sites uh, where people will hook up on social
Mm-hmm.
media with someone that they don't know. Um, it may be someone that you do know, but it's not typical. It's usually a disconnect in terms of relationship. It's hard for someone to do that with someone that they know. It's easier when you don't know that person. I mean, when you
Mm-hmm.
look at historically and things in the news, when people have targeted, transgender women or, gay men, they usually do it. Many of them have done it out of spite, and they have targeted them. So there
Mm-hmm.
is it is real.
Mm-hmm.
I've
Goodness.
worked in a prison setting, and I remember I've had a bunch of jobs. Nurses always have a ton of jobs. They always have to keep a job in their back pocket.
Yes,
And
yes.
I remember I remember one instance I was working in a prison, and the patients had to come down to the infirmary, and I remember this transgender female who was in the general population at that time. They didn't respect them to put them with the gender that they identified with.
Mm-hmm.
And this woman was raped. So they sent her downstairs to the infirmary, and they asked me to see her. They didn't tell me why, but when I went in, she was tearful and upset. And, you know, when I asked more questions, she told me what happened, and that's another means of savagery, you
Mm-hmm.
know, but, but what you alluded to is real as well.
Wow. So, all in all, I wanted to bring awareness and education to STDs and how one can contract them, how one can be safe. Um, because if we're honest, growing up as a church girl, they say don't do it, but we know that some girls, some boys do it, and some when you're told don't do it, you go and do it, but then you don't know of precautions sometimes, or or you think but then you get in a situation, and sometimes an unwanted friend can stay beyond that encounter that you have. Um, so essentially, what is a STD?
So I'm glad you asked that question. So STD is sexually transmitted disease. But in current language, we like to use STI because there's a
Okay.
certain amount of stigma attached to the idea of a disease.
Mm-hmm.
It kind of makes it more impersonal and again opens you up to uh, people kind of looking at you side-eyed.
Mm-hmm.
So society has changed it to sexually transmitted infection. And in all honesty, sometimes when I ask people, have you ever had an STI, they're like, what are you talking about? They still refer to disease. So it's something that's in progress. So an
Mm-hmm.
STI is any type of infection that you could acquire sexually that would either be a bacterial infection or a viral infection, or there are other categories um,
Mm-hmm.
of microorganisms that are problematic, that would be that unwanted friend. There's a myriad of symptoms that come along with it. Usually there's some type of discomfort in the area that was most likely affected, whether it's in your genitalia, um,
Mm-hmm.
either rectally or vaginally, depending upon the type of sex you practice, and even orally. Um,
Mm-hmm.
if you're engaging in oral sex, then you can have some symptoms that are problematic. I ask my patients very clearly, when I meet with them, and I teach my colleagues who don't necessarily treat patients who have HIV or ST or any type of ID to have the ability to be transparent with patients and have a good sex history conversation.
Mm-hmm.
Are you sexually active? Are you having sex with men, women, or both?
Mm-hmm.
If you're having sex with men, are you top, bottom, or verse?
Mm-hmm.
So if you're a woman, are you also engaging in anal sex? Because some
Mm-hmm.
women do. Um,
Mm-hmm.
and that's important to know. Are you engaging in oral sex? Were you using a condom? There's many questions to ask about that.
Very good.
Mhm.
So I gotta put a stick in for a second. Hey, Mama Wanda. Yes, this is necessary, but I also want to throw out a disclaimer. Mm. I'm just trying to educate us today of being aware of things that can happen. I'm not telling anybody to go out and do these things because now you're educated and you know what you can do. I'm trying to help you to be safe if you do go out there and do whatever. I work with enough children to know that a parent can want the best for them, but that child is going to make their own decision. An adult could want the best for themselves, but they're still going to make a decision too. So the hope again tonight is to educate us, to help us to know how to be protected, to help us to be aware, to know how to support somebody that may be going through something that
Mhm.
we're talking about,
Mhm.
and all that jazz. But I don't want y'all to be saying, because Jen taught me that. No, Jen didn't teach you that.
Mhm.
Jen taught you, wanted to educate you today, okay? And
Mhm.
again, we're talking about all different, wherever you find yourself on the tadpole or whatever relationships that you have, because
Mhm.
guess what?
Mhm.
It can affect anybody. Like they say, a bullet has no name on it. These things still have no name on it too if we're not safe. And in this situation, we can be safe. We can guard
Mhm.
ourselves and protect ourselves a little bit, okay? In church, we
Mhm.
say, Amen, Amen.
Amen.
Okay,
Amen. And let
okay.
me just say something, Jen.
Yes,
I'm kind of glad that came up because here's the thing. I am an unapologetic Christian. And you say,
yes.
well, how can you be an unapologetic Christian and do what you do for a living? And I had to ask myself that question because I struggled with that.
Mm-hmm.
But let me just say this. You have to be salt and light.
Yeah, absolutely.
Jesus didn't come to heal the sick. He came to
Come
heal
on.
those who need a physician. Okay. I'm
Yes,
not taking the Bible out of context. If you know your word like
yes.
I do, you know exactly what I'm saying. And for me to
Mm-hmm.
say that I'm not going to treat one population of people because of what
Mm-hmm.
they practice, then guess what?
Mm-hmm.
Nobody would get treated because
Absolutely.
anybody who walks through my door could be an adulterer, whether they're
Mm-hmm.
doing heterosexual adultery or not. They're going to be
Mm-hmm.
open to these types of STIs and STDs.
Absolutely.
They're going to be thieves, liars,
Mm-hmm.
you name the sin, it's
Mm-hmm.
there because none of us
That's
are
it.
righteous, no, not one.
Come on. Come
So
on.
here's the thing, there's a time for us as a church, and I literally just had this conversation with one of our members, that as a church, we need to recognize what
Mm-hmm.
people are doing and stop tiptoeing around it, because they'll sit in church and act all pious and pretend like something's not hurting them when they hear these things. But guess who they
Yes.
come and talk to in
Mm-hmm.
private? Because they'll say to me, I can only tell you, Dr. Myra, because if
Mm.
my family knew, they would
Mm.
judge me and I would be thrown
Mm.
out of my house. Is
Mm.
that love? Because
That's
the
not
last time I read, love covers a multitude of sins.
multitude. I
So,
love that.
don't make me keep going there. I can go there
Yeah.
too.
Look, I'm gonna jump on that box right with you because that's why I feel like, so many times, no matter what it is, because again, sin, as small, big, whatever, it's sin and things of that sort. But God shows us love. And how do you win people? With love, with kindness.
Yes.
You like you said, sometimes you do hit it hard, like, God says that you do X, Y, and Z, but I still love you where you are. Why? Because he loved me. My God, when I wasn't doing the stuff I was supposed to be doing. So how can I talk about you when I got something poking in my eye? So again, that's why I
Okay.
always like to set the record straight. We're trying to help each other. No matter where you find yourself, we try to meet the whole person.
The
We love the
whole
whole
person.
person, flaws and all. Because guess what? I got them, you got them, we
Right.
got them.
Right. Because until you're delivered from whatever your sin is,
Come on.
this is a reality.
Yes.
Such were some of you,
Yes.
alcoholics.
Mm-hmm.
Such were some of you, cigarette smoker.
Come on. Come
Such were
on.
some of you. Such was
Yes.
me. So we
Yes.
have to have these conversations, because if we don't have the conversation, who's going to have the conversation?
Yes.
Who do you want them to hear it from? This
Mm-hmm.
doesn't mean just because you talk about sex doesn't mean you're necessarily promoting it. But the
Come
reality
on.
is we are suffering from these issues.
Yes. And again, the hard part is if I don't talk about it and you go out there and try it for yourself, I don't know what
It's a
you're getting
problem.
yourself into.
Oh, I can tell you what you're getting
Well,
yourself into.
yes, but like the world is an oyster. Anything is possible and things of that sort. So the hope is that you can have these conversations with your children, loved ones, and things of that sort. I mean, I had these conversations with my girlfriends. Like, yeah, girl, I was with such and such. Did you use protection? Are you ready for a baby? Are you protecting yourself? These are
Right.
conversations even as adults we have to have because
Have to have it.
I get it, live your best life, but also protect yourself. Take off the rose-colored glasses. That boy said, I love you. You're like, oh, it's going to be. And then you find out some other things down the line. Or that girl says whatever, or whatever smooth talking happens. We
Hmm.
want to be aware. We want to, again, protect ourselves. Shana said, say it louder for the people in the back. Look, that's what we're talking about. This is what we're trying to do. Yes, Miss Thurman, she said she is speaking the truth. Go ahead, go ahead. So, now that we done threw that out there to kind of set the air, clear the air, let y'all know we meeting everybody where they are and doing it in love.
In love.
Because
Speak the
wherever you
truth in
find yourself
love.
again, we want you to still use protection because again,
Yes.
anything is possible to happen. But let's talk about these women. Why is it that the women have a higher rate?
So here's the case: higher rate than, you know, gay men aside, Black women are always, just like Black men, the African American race are always at the top of the food chain when it comes to any health complication. There are a myriad of reasons why. It could be a lack of resources. It could be a lack
Mm-hmm.
of education about issues. It could be a lack of fear of coming forward for treatment.
Mm-hmm.
It could be many, many reasons. Um, right now, the African American community is very much vaccine hesitant because they distrust the healthcare community. There aren't enough people who look like us in the healthcare profession
Mm-hmm.
so that you can hear something from someone that you trust and or identify with, or who could speak to you in a language that you understand. It's not just that, oh, we're both speaking English, but speak to me in a way that you get it. I've had many patients say to me,
Mm-hmm.
wow, no one ever explained high blood pressure to me like that before. Nobody ever explained diabetes like that to me before. I'm like, okay, well, how can you go to med school or go to be a provider of any sort, PA or nurse practitioner, and you get so smart that you don't know how to break it down so the average person can get it? You have to do that. That is part of what your job is in order to educate the person in front of you. And much of
Absolutely.
what I do as a provider is not just me writing you a prescription. I need to educate you so that you know how to care for yourself. So,
Mm-hmm.
when we're talking about STIs, we're talking about bacterial things. We're speaking about chlamydia, gonorrhea, syphilis. Okay, those are all
Mm-hmm.
bacterias, and we have medications to treat and cure those as they come about incidentally. When we're talking about viruses, however, it's a little bit different. There's no
Okay.
cure per se for a virus. We're talking about, and forgive me, Jen, if I'm jumping ahead, but I
You
just
are
want to make
right.
sure
You're
that I get
right.
that information in there.
Mm-hmm.
Um, we're talking about virus, we're talking about things like hepatitis B,
Mm-hmm.
as in boy,
Mm-hmm.
is very much a sexually transmitted disease. And now there's been more evidence to show that hepatitis C, as in cat, which most people identify as, oh, well, alcoholics get that, or so they get cirrhosis of the liver, and maybe IV drug users get that. Well, now there's some conversation that there may be some evidence to support sexually transmission of C. We're talking about human papillomavirus, which creates warts. We're talking about herpes simplex virus, which is the same, herpes simplex 2 versus simplex 1. One causes fever blisters, and 2 causes genital herpes. So it's, those are the viruses. And then we're talking about trichomonas, which we see from time to time, which is a parasite. But those are the ones that are common in the US. There are many others that we don't see as frequently here in the United States that we'll see in sub-Saharan Africa, or in South America, or in those parts of the world which are more tropical. So there are other sexually transmitted diseases that we see, but those are typically the most common ones.
That's good. I like when you're saying like some pieces that I've read as you were speaking. I wonder how many of our children are itching because they're fearful of coming forward because they need treatment. Growing up, when you take your bath and things, mama used to ask, anything itching, does it hurt? You all right? When you get different things happen, they would ask you these questions to help and guide you. But do you have that safe environment where somebody could say, I don't feel good down there, and I feel like something ain't right?
Girl, please. Let's just talk about scabies. Because if you have sex with somebody who has scabies, guess what? You're going to get scabies in your genitals. It happens. And so not having a safe space is really problematic on many, many levels. And I don't want to go back to beating that horse, but I really could. So maybe there'll be a day when we can do horse beating for, a period of time. But one of the things that I do with my my patients is I will say to them, patients come in with their parents, the pediatric ones. But if they're 11, 12, 13, I politely ask the parents if I have permission to speak to the child in private, anywhere between the age of 11, 17. And I'll ask that child, are you having sex? Does your parent know? Are you using protection? Do you know how to use a condom? Do you know what chlamydia, gonorrhea, syphilis is? Would you know what to look for?
Yes.
Who would you go to if you found yourself pregnant? What would you do if you got someone pregnant?
Yes.
I ask them those questions, and I tell them, look, if you have other questions and you need to come see me, you need to come see me. Your parent does not have to come. And in the state of Pennsylvania, that's how it works. I had a 17-year-old boy come see me for his physical. His mother, she brought him and the siblings to the office, and she, I wanted to speak to him, going through my, she was in the other room with the other siblings trying to get them settled and ready for their appointments, and I had him, so I hadn't asked permission to speak to him quietly. But then when I was in the room, I looked at him, something said, ask that boy if he's having sex. I said, you having sex? He said, yes. And I said, you having sex with men, women, or both? He said, men. I said, okay. And I went through my whole spiel. This young man has been one of my most faithful patients. I put him on something called PrEP, pre-exposure prophylactic, and to protect him from getting HIV. Because here's the thing. Remember what I said earlier today? If you're African American male and you're having and you're identify as gay, or bi, you're having sex with both, you have a 50% chance of getting HIV. I put that boy on PrEP immediately because he always comes into the clinic with an STI. And when you see one STI, the likelihood is that HIV is not far behind. In fact, from a clinical perspective, if I have a patient who's been diagnosed with an STI, if anybody has been diagnosed with STI, if anyone listening has been diagnosed with an STI within the last 6 months to a year, and you have not been checked for HIV, you need to be checked. Because when you see one, you see the other. And chlamydia is the most frequent STI that we see. But if you see gonorrhea and syphilis, especially syphilis, and actually maybe gonorrhea too. I think there's always been kind of neck and neck.
Hmm.
Then HIV is not far behind. And from
Wow.
2014, it was like 1.4 million cases of STIs, according to the Centers for Disease Control throughout the
Woo.
country. That number has now gone up to 2.5 million cases of
Wow.
STIs in 2019. And those are the ones that they've been able to count.
Right, because everybody's
So,
not coming. Mm.
right, right,
My Lord. So this
exactly.
is interesting. I like that you do this for 11 and 17-year-olds, but can you do this for 17 and above too? Because sometimes they need the conversation. Are you having sex? Are you using protection? Are you ready for a baby? Are you ready for STI? Are you ready for STD? What protection are you using? Would you like some birth control? Would you like some condoms? Would you like the patch? Whatever
Yes,
it is. Because these are
yes.
conversations to have. I also love that love and rapport that you made with that young man, because sometimes not every doctor, let me say that too. Every doctor is not a teaching doctor. You know,
Right.
I've been in a courtroom for cases and things of that sort, and there's some judges that's like, no, this is what happens, that's how it has to be. But then there's some judges that say, this is why I'm doing X, Y, and Z. And with a doctor, it's a benefit to have a doctor like that. FYI, I mean, TMI, to, I don't know, whatever. A couple of my doctors, my primary doctor, my gynecologist, my dentist, even my eye doctor, we have conversations to really know the history and things of that sort. We build that rapport. They're educating me on what it is they're checking out, why they're checking it out. And then I get to ask questions too. And it's so
Hmm.
important. But unfortunately, sadly, I have experienced some doctors where they haven't taken that extra step to really explain some things. And then
Hmm.
if I don't know, or if I don't know to ask, or it's not on my mind, and then I leave and go home, I'm like, Dad, I should have asked X, Y, and Z. So
Hmm.
the point, the thing that you take that effort to do that, one, hats off to you. Especially with building that relationship with that young man, to be able to have that lasting relationship where he feels like I have somebody that I can come and talk to, that's not going to judge me, but that's going to help me. And so many times we don't have that person,
Hmm.
or we don't get to come to a doctor as caring as you to get that, or we do go to the doctor, or we don't go to the doctor, or it's just a whole mess going on, and we don't know what's happening. We just itching. Something just needs.
Something ain't right. It
Yes, yes,
burns.
yes.
Yeah.
So,
Yes.
so,
And
so
and I do have that conversation with my adults, obviously, but I love the way
mhm,
that you said that, because I have had adult patients who, I as a part of what I do, I'll ask them, are you on contraception? And they'll say no. I'm like, okay, so are you planning to have a baby? No. I'm like, well, listen to me. If you're having sex and you're not on contraception, then you're planning to be pregnant.
mhm,
Oh,
mhm,
oh, no, I'm not. I'm like, oh, yes, you are. Because if everything is working, if all the plumbing is clear, you're
yes,
gonna get pregnant. It's just a matter of
yes,
time. And
mhm,
and sure enough, I've had patients who, come to me and ask for plan B, another struggle in my head, but it's the reality. And
mhm,
and I can't, it's a fine line between educating and scolding. Okay,
mhm.
because I'm still dealing with adults.
Right, right.
That's not my job to scold. And I've been charged. Remember I said I shoot from the hip and straight between the eye, and that tough love.
Mhm,
Sometimes
mhm.
that love sounds like scolding, and it doesn't
Yes.
mean to. It's just that this is the reality. You're here, you're asking me for plan B, but we had this conversation 6 months ago when you said that you didn't want to be on anything, but you don't want to have a baby. You
Mhm.
can't have it both ways. Because this is a person. So, which one is it? Do you want to be you know, on birth control, or do you want to have a living viable person? So it it is what it is. One time I get it, but two
Mhm.
and three times,
Mhm.
I don't know.
Mhm. So I have a question for you. If so you have a couple, they are they're saying it's only them, me and my boo rocking to the end of the song, and somebody ends up burnt. Somebody has STI, STD. What are the possibilities of how it came about? Is it just that somebody did step outside of that union, or is it possible that it did formulate from those two people? Like, where does the bacteria actually start from? Does it just say, "Oh, from this guy, bam, you're it"? Like, where did it generate from? Was it from somebody else? How did that
So
work?
here's the thing: you cannot get HIV gonorrhea, syphilis, chlamydia, or trichomonas from a toilet seat
Mhm.
or from drinking from someone's cup. The most likelihood is that there was an exchange of semen or vaginal secretions
Mhm.
or rectal tissue
Mhm.
or oral secretions that transmitted that virus or that bacteria.
So the person already had it, but how did they initially get it? Like that's what I'm trying to find out. Where was the
No, I'm
baby?
saying they got
Oh,
it from somewhere else.
okay.
The
Yeah. So two
likelihood,
people that's together, like this, my boo, moo, moo, moo,
mm-mm,
and somebody
your
gets
boo
messed
had an
up. Somebody stepped
excursion.
out.
Your boo
Okay.
had an excursion, and
Now
even
my
if that
now my other
excursion
question is,
was prior to you,
mhm.
maybe it's very possible because syphilis can be latent, and you can have syphilis for a year and not know it.
Wow.
And let me preface that. You can have had syphilis and its symptoms and not paid attention to it, and it's
Mm,
still there until it's treated. So now that
got it.
treatment has gone from one shot in the butt with an extraordinary amount of thick white uh, penicillin, bicillin,
Mhm.
4 cc's thick milkshake like, and you're going in your bootay. Okay. Now that has
Mhm.
elevated to 3 shots in a series that you have to get 1 week after the other for three
Mhm.
weeks. And if you
Okay.
miss a week, we got to start all over again.
Oh, nobody got time for those needles. I barely made it through the needles for whatever they do give. So please, friends, if just go and get your stuff. So this is my question though. So it's like, what came first, the chicken or the egg? What came first for the STD or STI? Like, where did it germinate from?
So ST viruses live in a host,
Okay.
and viruses will only survive as long as there is either a host or something to treat that virus, whether it's a vaccine or medication of some sort to treat it.
Mm-hmm. Mm-hmm.
So if the virus is not eliminated by either the host being eliminated, it's
Mm-hmm.
actually going to persist. So
Okay.
if you are the host and you're carrying this virus or bacteria and you've not been treated, you're going to pass it from one to the next. Chlamydia, extremely common.
Mm-hmm.
Herpes, very common, 1 in 5.
Mm-hmm.
Um, uh, Human papillomavirus, very common. But the interesting thing about HPV is that there are now treatments, the human papillomavirus vaccine, that young girls and boys should get starting at the age of 11. Okay. And now the
Wow.
insurance companies have gone to as high as 26 and in some instances up to 45, but they don't want to pay up to 45. But
Got
here's the
it.
thing, those vaccines can
Mm-hmm.
actually prevent you from getting HPV. And it is the
Okay.
only known vaccine that can cure or prevent you from getting a cancer. So you
Mm-hmm.
can't say that there aren't any vaccines that'll prevent you from getting cancer. You can't cure it, but it'll prevent you from getting it. And boys should
Yes.
get it as well as girls because then they can't carry it to a female or another male partner and transmit it. So again, they would be the host
Okay.
carrying it elsewhere. So the viruses have been in existence for as long as we've had humans. It's a
Got it.
cell, it's a microorganism. It is, you know, viruses mutate. They change from one thing into another, but they pretty
Okay.
much stay in the same class.
Okay.
Coronaviruses behave a certain way. There's certain other um, viruses that behave very similarly. For instance, chickenpox.
Mm-hmm.
Chickenpox, varicella virus is the same virus that you see in herpes. It is they're all in the chickenpox family. The
Got it.
meningeal viruses, all of those, they travel in families.
Okay. Right. I was just trying to find out how did that person become the host because I don't know that they wanted to be the host, but unfortunately they
Right.
became a host and then had
It's
some
uninvited
guests over
guest.
and then it kept on going.
An
Mm.
uninvited guest. And until you find a way to get rid of that guest, you may end up giving it a transferable invitation, uninvited
Mm.
invitation.
Mm. Mm,
or unless you as the host die with it and maybe not spread it, but it is what it is.
got it. So, which ones did you say are curable? Which ones aren't curable? And which ones are manageable?
Right. Great question. So the ones that we can cure: chlamydia, gonorrhea, syphilis, all bacterials. We can cure those. We can cure trichomonas, which is not a bacterial. It's another microorganism, a parasite. We can cure
Okay.
those. Okay. Um, HIV, we can manage.
Okay.
Eventually, I think we're going to get to the point where we cure it, but right now it's very manageable.
Okay.
Um,
So, when
hepatitis,
you say manageable, what do you mean? Like one can have it and not give it to somebody else?
that is
Or,
correct. That
okay.
is correct. You can, the medicines are so much better now than they were 30 years ago. Remember, I was saying I
Mhm.
was giving like 6, 10 pills, 3, 4 times a
Yeah.
day to patients.
Mhm.
Now, if we get you in a place where I catch you early in your diagnosis, and you haven't been on any other medications in the past for HIV, and you haven't developed any resistances, you can be on one pill once a day, and it can keep your viral load to the point where it's undetectable. If you are
Okay.
undetectable, you cannot transmit it. And you can, in fact, if you're a male, impregnate someone without giving your partner or that child HIV. If you're a woman and you're undetectable, then you can, in fact, become pregnant, carry the baby without any complications, and that child not have HIV. So it is
Okay.
a very livable, manageable virus, and it's not what typically is going to kill the patients nowadays who are living with HIV. They're going to die from other things:
Okay.
diabetes, obesity, hypertension, other
Got
things,
it.
but
Yep.
not from that.
Okay. So, a question with that before you go on: if if it is manageable, you have it and it's manageable, should you let your partner know that? Still.
Yeah, I think, and here's the thing: I think that it's fair, because we're not going to get rid of the fear and stigma behind HIV until people understand what it is.
Mm-hmm.
Just like you marry people and you let your partner know that you got sickle cell. Oh my goodness, if you have sickle cell and I'm carrying the trait, we could potentially have a child who has sickle cell, and they're going to go through all of these, health issues as they move forward. If you know that, you would share it, but we don't attach the same stigma to sickle cell as we would HIV,
Mm-hmm.
because we're attaching all of these presumptions about how that person got HIV to the diagnosis, and that's not for us to do,
Mm-hmm.
because everybody's situation is not the same.
Right. And that's it. It's really important on that education piece. And if you do have it, this is the love of your life. Because one, that's not something that we just say on the first day. Hey, also I had manageable HIV. It takes time to be able to feel comfortable to open up to share with that person. But also
Hmm.
maybe is it an option where they can bring their significant other to an appointment to be
I
educated?
I encourage it all the time. In fact, I have patients who, once they're diagnosed and their partner is not or they're in a what we call a discordant relationship, then I invite them to come to the office and have a conversation with me about what HIV is, what it isn't.
Okay.
Patients who are not um, living with HIV, and they're in a relationship with someone who is living with HIV, they can take
Mm-hmm.
medication to prevent them from getting HIV. They can be on PrEP, just like the medication I put that young boy on. I have
Mm-hmm.
many of my African American female patients who are on PrEP.
Mm-hmm.
I tell people PrEP is for anybody: male, female, straight, gay, zebra. I don't care what you are,
Yes.
pansexual, whatever you are. You can be, if you're a sexually active person and you want to protect yourself from HIV, then, and you're not in a mutually monogamous, exclusive relationship,
Mm-hmm.
then you should consider PrEP, because it will protect you from acquiring HIV.
Okay. And PrEP does not still protect you from pregnancy. You still have to do the protection for that.
And you still need to protect yourself by using a condom to protect yourself
Yes.
from chlamydia, gonorrhea, trick, herpes, all the others.
Got it. So I stopped you where we talked about the manageable. We talked about the ones that were curable, the ones that are manageable. Let's talk about those ones that aren't curable and what that looks like.
Yeah. So hepatitis C actually is now curable. There was a
Awesome.
time when there was a treatment for hepatitis C called interferon that came out in the 1990s, and it was very painful and problematic and uncomfortable, and people would rather die with hepatitis than live through the treatment. But now hepatitis is so easy to treat, and
Mm.
it's definitely within reach. At one point, they were making it so difficult for people to get care because it's so expensive. The treatment is very, very expensive, but most insurances will pay for it. And in fact, in the state of Pennsylvania, will pay for anybody who's uninsured to cure them from hepatitis C. There are
Mm.
medications that I can put you on if you have hepatitis C that you can take for 8 weeks or 12 weeks, depending upon what what I see when I do your lab work and your lifestyle. All those things go into my decision of what medicine I'll give you, that you will be 100% cured. 95% of those patients are 100% cured 8 to
Wow.
12 weeks afterwards.
Very nice.
And that most people who have hepatitis C do not know it. Um, we're having lots of our baby boomers, people who are born between the years 1954 all the way up to, I mean, excuse me, 19, what is it, 1935 to 1968, need to be
Mm.
tested for hepatitis C if you haven't been. If you've ever used any type of IV uh, substance where you've injected, even if it was once, if you've ever
Mm-hmm.
used a straw to snort or sniff cocaine, or you shared a straw with someone, or
Mm-hmm.
if you ever got a tattoo that was a house tattoo or jailhouse tattoo, or your
Mm.
girlfriend and your boyfriend and your friends all decide to give each other tattoos, or you gave each other piercings, or you shared a
Mm.
razor with somebody and you didn't know their
Oh
status,
goodness. And y'all just
then
go get the clean stuff. This I'm overwhelmed right there.
yeah, or
Sharing
toothbrushes.
praises. Party
Toothbrushes,
oh
yes.
Lord.
Yeah. Then you need to get tested for hepatitis C. And hepatitis B is is a little different. Hepatitis B we're managing.
Okay.
And okay, managing borderline cure because it can go away and stay underground treated. You may need to be treated for 6 months, and then
Mm-hmm.
no viral load is detected. Um, and then you're checked every so often to make sure it stays away, or you'll be on medicine for the rest of your life to make sure you don't have another flare up of hepatitis B. But hepatitis B is transmitted from mother to child and
Okay.
or sexually with another partner. So that
Okay.
one is a little more difficult, and in fact it's more deadly than hep C. So if you
Mm.
have not been immunized against
Mm.
hepatitis B or immunize your children for hep B, then you might want to get immunized. Even adults, I'm checking, when I check people for STIs, I often will ask them or look at their age range to see if they've been immunized for hepatitis B, and I give them a series of 3 shots to get them protected from it.
Got it. Mm. So we can you can't get an STI from not having sex. It's some kind of engagement that you had to get that, correct? Is what we said.
Yeah, because, and here's the thing, even with herpes, even if you're not engaging in penile, vaginal, penile, anal sex, any type of skin to skin contact, if you have
Mm.
herpes, and you have maybe even an open wound, you can transmit and or receive herpes. Um,
Okay.
so herpes is skin to skin.
Okay.
So that heavy petting, that rubbing, oh, let me just touch it, let me just lay up against you.
Mm-hmm.
Can we talk? Can we keep it real?
Mm-hmm.
It can be
Please do.
transmitted.
Yes.
If you're engaging in oral sex, you can get, I ask my patients what kind of sex you had. I will swab your throat at the drop of a hat.
Mm-hmm.
And I have found multiple cases of oral pharyngeal chlamydia, gonorrhea, syphilis, and treat you
Mm-hmm.
accordingly. Because you think, okay, well, I'm not going to get pregnant, but I'm just having oral sex. Well, you could still be open to something that you didn't want.
Mm-hmm. Mm-hmm. That's a good one too, because a lot of times people say that's not sex. Sex is sex. If you're doing any contact of those body parts, any
It's
kind of way,
sex.
mix, match, applesauce, crisscross.
Yes, yes.
Call a spade
That
a spade.
that is so key because I've had many young patients who don't consider oral sex,
Mhm,
and they will engage in that very quickly, and they need to be taught that that is a sexual
mhm,
act.
mhm, mhm. And not knowing that they have options with that too. As they have a mouth condom, right?
Yes, there's a
Mhm.
dental dam.
A dental
You
dam.
know,
That's what it's called. Yes,
hmm
dental dam,
and
condoms, use
yes,
protection.
and there's such a thing as a female condom.
Yes.
You know, if you want a condom, come on over to my clinic, and we just giving them out like candy. And I heard somebody told me, one of my patients told me that
You do not like candy, friends. Go get your candy. I'm teasing. I'm teasing. I'm sorry. I'm sorry. It was. I'm sorry. I'm sorry.
um
Bad.
one of the I want to say they told me it was either Foot Locker or one of the sneaker stores on 52nd Street were giving
Mm-hmm.
out condoms. And I said to myself, you know what, that's a great idea.
Yeah.
Because where else are you going to see young people at? In the sneaker store.
Mm-hmm. Mm-hmm. And if they can't afford it, they can't get it. So being able to have it, um, and having it, it made me think of, I think it was the wood where he went to buy a condom, but he had it so long that it was no longer good. So again,
Right.
having fresh, they have expiration dates. So having something that can be used and that will really allow for protection.
Right. And know the difference between your condoms because there's such a thing as a latex condom and those that are non-latex.
Mm-hmm.
And the latex condom actually offers more protection. It's not necessarily the preferred method for some people because it doesn't have the same sensitivity, but
Mm-hmm.
be aware that there is a difference.
Yeah. And couple also other service announcements. Don't fall for the okie dokie. Don't feel the same. Put that on if you're trying to protect yourself. It's not just about them. You want to also protect yourself. Don't fall for the okie doke. And
And
it's
don't just
another
put
one.
it in for a second and take it out and then
Yes,
put the condom on.
yes, yes. Because something comes before the storm, and that before the storm can also cause some things to happen. You want to be precautious. And then the other piece is what did you say? Hopefully you come back to me. Don't fall for the okie doke. Oh, and girls, guys, whoever, don't play games and poke holes in things. Because one, it's more damage than nine. You thinking that this is the love of your life, and then you find out I thought I was gonna get pregnant. Instead, I got another visitor. So again, don't play the games, friends. Don't play the
And got
games.
pregnant, which
And got
actually
pregnant.
complicates.
So again, we talking about savage love. People can be vicious or think that they're doing something that's going to benefit them, and it doesn't work out as they hoped. So, I always joke about Medea. She said, Mr. Brown will always say, Cora, you can get pregnant from kissing. Is that true? That's what Mr. Brown said.
No.
I'm trying to find out how truthful Mr. Brown was.
I find Mr. Brown extremely amusing, but he's not accurate in that. You can get
Okay.
pregnant from kissing. You can catch a few other things from kissing, but
Mm-hmm.
pregnancy won't be it.
Got it. And I like to use him as an example only because like he makes stuff funny, but he's also trying to educate. And then he break down, no, these different things can happen. Especially the one where he went to the doctor, and that was a whole event. Polyps, he was confused. He thought it was polyp, and it was just a mess. But I appreciate it because one, we're trying to educate those, and that's what we're doing here tonight as well. So, how can we avoid getting an STD, STI? We talked about it a little bit. One, like some make shit up from the conversation we've had tonight.
So here's the thing. If you don't want to be pregnant, get an STD or STI, you can either be abstinent because that is a surefire way to prevent pregnancy, getting an STD or an
Somebody
STI.
says you just cuss. What is abstinent? They know what it is. They want you to clarify because they like that's not something I
Yes.
want to do. That's not with the in crowd.
Yeah, it's not with the in crowd, but guess what? That person who stands out and decides
Mm-hmm.
not to engage
Mm-hmm.
in sex
Yeah.
until they're ready and with a mutually exclusive monogamous partner for life, they're
Mm-hmm.
likely not going to have any form of human papillomavirus. They're not going to have any history of an STI, and they're likely
Mm-hmm.
not going to have an unwanted pregnancy. So abstinence is still a thing, and it's okay. It doesn't make you any less of a person or sexual being. Doesn't make you stiff or stodgy. Um, People abstain from alcohol and they're not judged. Or abstain from driving without a seatbelt. You don't judge them for that. would you drive without seatbelts? Some people do, but it's not the smartest thing to do.
Right, right.
So, and that was my lead in for the other way. That is to use a condom, to use
Mm-hmm.
a condom properly, whether
Mm-hmm.
it's a female condom or a male condom. Use a condom.
Got it. I also just want to highlight, just because you're on birth control, so like say you have the patch or you're taking a pill, that still does
Yes,
not
prevent you
stop you
from
from
getting pregnant
getting. One,
because
it
there
doesn't stop you from getting pregnant, but you also could still get STI, STD, correct?
just because you're on contraception, it doesn't protect you from getting an STD.
Mm-hmm.
It may protect you from getting pregnant, depending upon the form of contraception you're using. There's some
Mm-hmm.
contraceptions which are more effective than others.
Mm-hmm.
At the top of the food chain, we're talking pill, IUD, Nexplanons, those types of devices.
Mm-hmm.
Less useful and less reliable condoms, but they
Mm-hmm.
do work. They
Mm-hmm.
do work. So, ask your primary care provider what's right for you, and you need to make the decision as an individual. Um, what do I, what am I willing to tolerate in terms of the
Mm-hmm.
consequences? Am I
Yes.
willing to accept the consequences if there's an unwanted pregnancy? What is my
Right.
plan B?
Mm-hmm.
What are the consequences if I find that I have this unwanted um, sexually transmitted infection, whether it be a virus, bacteria, or or parasite,
Got it.
or scabies, another type of parasite.
So you mentioned Plan B. What
What
is
am I
Plan B?
willing?
Oh, got it. And you mentioned Plan B. What is
Hmm.
Plan B? It's a
Hmm.
pill
So
that's supposed to.
Plan B. Yep, you're on it. Plan B is a pill. It is a pill that you need to take within 72 hours of having unprotected sex. So that in the event that you think you could possibly have gotten pregnant during that encounter, then the pill will ideally disengage that implanted egg from the uterus and you will expel it.
Okay. So two questions related to this. Um, how how often can somebody say Plan B?
Mm.
And I say that because we get into a jam. Oop, let me just do this. Oop, let me just do this. Oop, let me just do this. Because my other question is, how does it ever lose its effectiveness? So how often can one take it, and does it lose its effectiveness? Like you shouldn't be taking it like 2 times in the same week. I'm hoping. But let's talk about that.
Yeah. That's a really good question. And I don't know that I've ever thought about it in that regards. It is hormonal. It is it
Mm-hmm.
is in it is intended to cause the hormonal response where you will remove the lining of the lining from the uterus so it would dislodge an implanted egg so that the egg is not once it's fertilized that it won't get fed and developed as
Mm-hmm.
human.
Mm-hmm.
But again, now we're talking about triggering hormones that are on a schedule. That's
Mm-hmm.
why most women have a regular period every 28 or 30 days or what have you.
Mm-hmm.
Whatever your regularity is,
Mm-hmm.
that's the case. And that's why you
Right.
ovulate at a certain time. We are meant to be time. Everything is done in order. So now
Mm-hmm.
that you're taking this pill that's meant to disrupt what has been put in order,
Mm-hmm.
what are the consequences of that? Now you're causing your body to have not just that hormone dislodge. Our hormones are kind of domino effect. One hormonal
Okay.
response is going to trigger and elicit other types of responses in your body. So
Mm-hmm.
it's not intended to do that. And yeah, you may run from one provider to the next to get that Plan B. But just like I've had that conversation with one of my patients, and she was a little irritated with me. Oh well, I'm sorry.
Yeah.
I meant no harm, but it was the truth. If you're
Mm-hmm.
not planning on being pregnant, then plan on contraception.
Mm-hmm.
And if you're not planning on contraception, then you're planning to be pregnant.
Mm-hmm. Yes. Again, I love this. I used to do a lot of healthy relationship workshops with young girls, and I would tell them, "I love you all. I care for you all. Y'all like my little nieces, little sisters, things of that sort. I want the best for you." But one was like, excited about all the bodies that she had. And somebody was like, oh, you had that many, they're looking at her bed. I'm not knocking you for that. But one, that's not the hippest, coolest thing, especially if you're not protecting yourself. And you don't want to you don't want to share a number just to be sharing a number when that's not the number to look good for anybody else. Because when people have their different judgments and things of that sort for you, and things that, but again, that piece of showing love to them, but also educating them. And that's what hopefully tonight was us showing some love and educating tonight with sex education 101, and how to be careful and not get in a savage love type situation. My last question about this, and then I have some other ones for you, is how often should somebody get tested?
I want to answer that question, but can I just add one thing to based on what you said? Every time you have sex with a person, you're having sex with the people that they had before you.
Oh, you cussed again.
I think that people forget that. And believe it or not, there's certain microorganisms and bacteria that you are exposed to when you have sex with that other person that you carry. And it may not be a harmful, overtly harmful microorganism, but those exposures can contribute to those abnormal pap smears. The likelihood of you developing human papillomavirus, the likelihood of you being predisposed to any other microorganisms, because it's the amount of exposure. You could potentially have sex with somebody who has a detectable viral load on one occasion and not get exposed to HIV if you're not on PrEP, but it's the multiple exposures to that person whose viral load is detectable that will put you or predispose you to also getting HIV. So I just want I want you to keep in mind that when you have sex with one person and they've had sex with 20, so you've actually had sex with 21 people. So now to answer your question, when you were asking how often should you get tested? I like for my patients to be tested for HIV at least once a year. And if you've exposed yourself to something, whether it's HIV or anything else, if you had a unprotected sexual encounter and you have not using PrEP or you didn't use a condom and you're having any type of unusual presentation, a painless open wound that was there for about a week and it went away, aka a chancre, okay, you've got syphilis. And just because that sore went away, syphilis didn't go away. Syphilis can be latent and be carried in your system 10 to 30 years, and it will affect your whole neurological system, and you can die from it. Ask Ben Franklin. Oops, I'm sorry. You can't, because he died from it. Okay. Yeah. So, you should be tested as often as you feel safe and or feel unsafe, but definitely get an HIV test once a year. I like to test my patients for hepatitis of any sort, at least once in their lifetime, more if their lifestyle tells me that they've been exposed more frequently. And the same thing with the other tests for chlamydia, gonorrhea, trick. If you're having any burning, itching, discharge, smell, the discharge just change colors, frequency, something that's just not right. And aside from your typical, and that you had this sexual encounter, even if it was a month ago, 2 months ago, then you may want to get checked.
Got it. Awesome. Whew. Chosen friends, I hope you guys have enjoyed this. I'm going to now just shift to our theme of letters to our younger self. What are some things when you reflect on a younger you and related in regards to anything of life? What would you tell your younger self?
I love this question, Jen. I would tell my younger self that I am much more valuable than I think. That I have the right to pick and choose. That I don't have to acquiesce to something less than what I would want as an ideal circumstance.
Mm.
just because I don't think something better is going to come along. I would
Wow.
tell myself to have more faith in the fact that someone mightier than me has a plan for me, plans to prosper me and not to harm me, but to give me a hope and an expected future.
Yes.
I would believe that. And I
Yes.
don't know that I had the wherewithal, the maturity, the self-esteem to have believed that. And if I believed that back then, knowing then what I know now, there's many decisions I would not have made,
Mm.
and some decisions I would have made.
Got it. Mm. Still one. Another one. How would you like to be remembered?
That one was a little harder for me because, you know, uh, I don't know, but I will say this. I'm a pretty sincere person, pretty transparent. What you see is what you get.
Mm-hmm.
Um, I try to make sure people realize that my transparency is without malice. Um, it is totally because I believe um, I'm offering something that someone could use, um,
Yes.
whether it's a loved one, a patient, a friend, a neighbor. Um, that I was sincere. I want people to remember that I was sincere. Um, and I'd like to be remembered for being generous with not just, any resource I have, but generous with my time and any information I have. I'd like to be remembered, and I cognizantly try to be generous
Yes.
and
Would you
kind.
say
Kindness is important.
that is my favorite thing?
Kindness is very important.
My favorite from Cinderella is have courage and be kind. I love that, because sometimes, we think that we can't do it, but we just have courage and then being kind because we don't know what that other person is going through. We want somebody to be
Yes,
kind with us, so trying to share that for both ways. Mm.
kindness, and the word says it, love covers a multitude of sins. So who am
Yes.
I to withhold that from
Hmm.
somebody else? That's not for me to do. Because
That's it.
if it was withheld from me, I'd be in a world of trouble right now, baby.
Man, I can't tell you how many times I want to say I'm gonna cut him off for Jesus, like, but did I cut you off? I'd be like, okay, how can I help you? Because just as he does for me, you want to do for others, and that's the love. That's what I signed up for. I said, for
Yes,
you I live, for you I die, and as you look out for me, I'm gonna look out for somebody else too, because it's only because of you
there
that
you
I'm
go.
still going.
There you go.
Mm. Would you say you have any regrets?
Um, I regret not learning to be kinder sooner.
Mm.
Um, I remember years and years ago, I told you I grew up in New York, right?
Mm.
Um, you know, Southern born, gr- grew up in New York. Um, not every household is as functional as it could be. So I had my little baggage, my issues.
Mm.
And, I remember years ago, my very first nurse manager on my first job, back then, I wore a big old Angela Davis afro. Now we
Yeah.
talking in the 80s. That wasn't the
Yeah.
thing. But I had a big old, the revolution will not be televised kind of attitude.
Yes.
And I was one of few black nurses in my department. I went to that hospital because I saw one black nurse there who I felt could mentor me.
Yes.
But so seeing a black nurse wasn't typical. And I just had a chip on my shoulder. So my regret was he said to me one day, he said, "Do you know the difference between being aggressive and being assertive?"
Mm.
And as soon as he said it, I knew exactly what he was pointing out to me. And I
Mm.
needed to grow up in that area. So if I have any regret, it's that I didn't learn how to be more tactful in my approach
Mm.
at an earlier point in my life because it probably would have saved me some difficulties. It's okay to learn how to say what you need to say, but say it
Mm.
diplomatically and say
Yes.
it in a way that you can still maintain a relationship and continue relationships with people. Because honestly, as humans, our relationships are the only thing that matters.
Yes. Another question. What words of wisdom do you have for potential future doctors or nurses that are tuning in?
Yeah. Let me just say this. If that is what's in your heart, if you are sure that you're sure that you're sure that you've been called to do this, then go for it, because the doors will be open that no man can shut. But
Mm,
those doors that are shut are only meant to redirect you to your path,
mm,
because there have been things that, like I said, I wanted to be a journalist, but here's the thing. Here I am being broadcast with you. I still
yes.
write for medical purposes. I do
Mm,
presentations. So
mm,
that part has still been manifest, but
mm,
the greater good is that I can be the arms and legs and eyes and ears of the great healer, and
very
interact
nice.
with people on all levels, all races, and all socioeconomic backgrounds. So, if that's what you've been told to do, then do it
Mm,
and be passionate about it. Don't be lazy. Put the work in, do your homework,
mm,
study,
mm,
get through it. But
yes.
I would not have it any other way.
Mm. So, friends, whatever it is that you're doing, be passionate about it. If that's what you feel you're called to do, doors will open. And if not, that was good. The shift as need be to still help you to be what you should be. Ah, thank you so much for joining us, Dr. Myra. What is a summation that you would like us to walk away with knowing from all that we've shared on tonight?
Hmm. Sex happens. Be responsible with your body, your sexual being. Um, Decisions can be lifelong, have lifelong impact, not just on your physical person, but on your mental, emotional self. We didn't get a chance to talk about what that means and impact there. Um, and be kind to other people. Don't be so quick to be judgmental. You don't
Mm,
know what that person has lived through. You
mm,
don't know what their experiences are. If you come across somebody in your family, in your household, who is shocking you by revealing this thing about them that you didn't know, put yourself in their shoes and imagine the angst and anxiety that they felt.
mm.
And just be loving.
Ah, mm. 11. We did not talk about the mental piece of it, but over here we are all about normalizing mental health and mental wellness, because whatever we go through, there's always that piece of what could I have done differently? How could I have protected myself? Stupid me, why me? Whatever thoughts that come to mind. And again, I encourage us all, if you're going through something and it is overwhelming, be sure to connect with a professional that can talk to you and, help you process those things that are going on. My guy, Sister Jeannie said, where can I find her office? They want to come see you. Now, Jeannie, you better not be going to get no candy. I'm teasing. I'm teasing. Where's your office? How can someone connect?
So I am blessed to work at Spectrum Health Services. The headquarters is at 5201 Haverford Avenue. I am their infectious disease program lead, and as I said, I do primary care for cradle to grave. And I also have the pleasure of seeing patients who live with HIV, hepatitis C, and I do all things COVID.
Awesome. Awesome. Again, look, I truly, truly thank you so much. I appreciate the piece that you shared of someone looking at somebody else and saying, no, I can't do that. And you stepping out and doing that, because that has opened up a gazillion more doors even for you. One, to learn and educate yourself on that, what you're in, but also to build that rapport and to be that mouthpiece for those that need that, that don't have that mouthpiece. So again, thank you so very much. Y'all be sure to check her out at Spectrum. If you know somebody that needs some support, or you have some more questions, give her a ring. She'll be sure to educate you. She does these platforms to do some educational workshops as well. So again, Dr. Myra, I thank you so truly so much. You got a friend in me, sis. I've enjoyed our conversation today.
Me too.
Um, yes, yes. Lisa said, great, frank conversation. That's it. Because again, tough talks, real talks. We're going to help you to live. Because I can't tell you to go out there and, you figure it out. And then you come back with all these different things. Like, but you didn't tell me that. No, sis. On June 21st, no, brother, June 21st, we talked about all these things to be able to, one, educate and bring the community to you. So thank you again, Dr. Myra, so very much.
Thank you, Jen, for having me. Thank you, guests, for listening. And Take care, everybody.
Yes. Oh, good night. Yo, that was amazing, Dr. Myra. She is the mom.com. Ask me how I know. You know too, because she just did that. Y'all see that afro on the side? Where she said she was rocking it, rough and stuff with her afro puffs. Yo, that was amazing. I am truly, truly grateful. I hope that you did learn something. I hope that you did walk away with something and that you will share it with somebody else to help them. Because guess what? What's our quote of the day? You were born to be real, not to be perfect. How fitting for tonight. You were born to be real, not to be perfect. None of us are perfect. We got to be real, friends. Things happen. We made some good decisions. We made some bad decisions, but things happen. But know that you were born to be real, not to be perfect. Thank you all so much for joining us. We do have a couple of announcements for you. Be sure to join us next Monday. I was about to say Friday. Friends, we're on Mondays at 8. Be sure to join us next Monday as we will have my friend Duran Coley talking about Dear Teenage Me. He's a therapist, so you know we're going to talk about that mental health, mental wellness, because guess what? Our youth has some things going on. We have some things going on as young people, so we want to make sure that we do address those things and talk about those things. Also, friends, tickets for our Day of Hope is now live. It will take place on Saturday, August 14th. Check it out.
Chosen Counselors and Friends present a Day of Hope. Parents and youth ages 13 through 18 are invited to join us on Saturday, August 14th from 10 a.m. to 12:30 p.m. virtually for this free event. Topics include using social media well, planning for your future, making it home safely, how to love better, spending and saving, and mental health matters. There will be 2 sessions for parents, a session on communication, open, safe space, and the second session will cover parent advocacy, how it looks, how it sounds. Tickets are now available for this free event. Planning to attend? Visit eventbrite.com, search Chosen Counselors, and select the link to register today. Be sure to download the Tools for Success app to stay connected with resources, job and scholarship opportunities, and upcoming events today. So join us on Saturday, August 14th for a Day of Hope. Be sure to mark your calendars and tell a friend, as this Day of Hope is brought to you by Chosen Counselors and Friends.
It's gonna be good. Yo, I am so excited about a Day of Hope. Guess what? Tickets were released today. It's a free event, and somebody registered today. And I can't tell you how excited I got. You have a gazillion more days to do that, but make sure you do register. If you are, if you know a youth that's 13 to 18, we're going to have some amazing workshops for them. And guess what? We have those 2 workshops for our parents as well. It's going to be good. So be sure to register or send it to somebody else that could benefit. All right. So next month is July, and guess what? It is our 1-year anniversary of Jen Cares. Woo! I can't believe that it's been 1 year. I'm not gonna lie. Sometimes I'll be like, how much longer is this gonna go? But guess what? Y'all keep coming back, so I'm gonna keep going until I don't have any more ideas. And I have some ideas to last us a little while longer, so we'll see how much further we go. So join us in July. We're gonna have a happy 1-year Jen Cares celebration. And guess what, friends? Let me show my face. We're only going to have 2 episodes. Why? Because it's a holiday, and I'm just going to take one of those Mondays to also just relax, reflect, and really appreciate this accomplishment of being able to do this, to share with the community about what's going on. So again, be sure to join us in July as we're going to have a celebration of our 1-year anniversary. 2 episodes. One episode is going to be a reflection of the year, but another episode is, guess what? Dun, 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 dun. I want to hear from you, my chosen friends. So I'm going to send out a link or post a link, where you can record something that you would like to share, and it will be aired live. Or if you would like to be a guest and talk to me live, 5 minutes with Jen, send me a message and I will set that up so that we can chit chat live. Why? Because I'm only doing this because of you, so that we could talk about whatever. You can ask whatever questions. Guess what? The floor is yours. You get to be Jen Cares for 5 minutes and talk to me. So that's going to be amazing. I'm so excited. Please do stay tuned. That is all I have for us on tonight. Thank you so very much for tuning in. I love you all and appreciate you all so very much. So until next time, love you all for real.